One of the beautiful moments for every parent out there, it could be a father or a mother, is to see their child take up the first step to utter a word. When a child starts taking up a step of, doing tata, mama, those are moments that really, really make every parent quite happy and, of course, are quite exciting as well. But it's always, obviously, a source of concern if at all the child is getting to 1 year and plus and there's nothing coming out. Obviously, that really worries a lot of parents and, of course, it raises quite a lot of concern. Now, a lot of questions have actually been coming in terms of what makes other children really delay in terms of, talking, in terms of, even uttering very, very simple words that identify that the child is actually progressing. We thought in this particular episode we can actually tackle that particular issue in terms of delayed speech and, of course, language. I'm joined by two experts who are going to help me look at this particular issue in detail, and obviously after this episode you should be able to know exactly during what particular period is a child expected to start uttering those simple words, and of course, in case a child delays in terms of speech, what are some of the steps that you can actually take? My first guest on the show today is Dr. Emilia Jumbe Madsen, who is Masden actually, who is a pediatrician, and of course she's coming through from Paediatrician Clinic as well. Good to have you after such a long time.
Thank you, Nelson, and good afternoon, viewers.
And of course, I'm also joined by a speech and language pathologist who is here now to give us, a few technicalities when it comes to, what happens when a child is just about to start talking, when a child is uttering those simple things, when a child is learning to communicate with the mother and the father, what you need to expect. And of course, my guest in that special department is Rolene Simbeski.
Yeah,
exactly. Yeah, I was hoping I could get it right without your help.
It's not the best last name for a speech therapist to have, that's for sure. So.
Good to have you on the show today. Thank you so much for your time.
Thank you for having me.
Appreciate it. I'll start with you, Dr. Masden.
Yes.
To start with, what causes speech delay in some children?
Okay. The thing that causes speech delay can be multifactorial, but the commonest thing is what we call developmental, meaning that area of the brain that is supposed to coordinate the speech and the language. Something goes wrong for that particular area of the brain. So when that happens, then you find that a kid's speech may be delayed. But there are other things that can cause it. So, for example, if a child is born premature, they can end up with various developmental issues, one of which might be speech. Sometimes if it's part of a bigger developmental delay or developmental picture, which may be kids who have autism, speech delay might also be a component of the reason why the speech is delayed. And sometimes when kids have had either nutritional or emotional deprivation, so if you have families where a kid is neglected and you're not interacting with that kid sufficiently, you might find that that kid ends up being withdrawn and speech may be delayed. But the commonest thing really is what we call developmental. So meaning that area of the brain, something has kind of gone wrong during the developmental period, and that specific area affects speech, the speech area in your brain, and that's usually what causes delayed speech.
How common is this particular situation, and is it a healthy condition, a health condition that requires, obviously, health experts' attention?
Well, I don't have our own local statistics as in what the numbers are for delayed speech in our country. But if we talk about experience maybe from when I was at University Teaching Hospital, you will find that until they opened a developmental intervention clinic, that's when we realized, oh my goodness, this is quite a big problem. maybe not as big as, like HIV or malaria or TB, but it's something that really impacts a family quite significantly for over a long time. Like we might say, oh, malaria, the statistics are very high, but you treat malaria, you get cured. But when you're dealing with kids that have, whether it's intellectual or physical disabilities, this is something that a family will have to deal with for a very long time. So, when we see, in my own practice, I would say that in terms of statistics, for example, if we see, last year we saw about 12,000 children in the clinic, and out of those, I would say between 15 and 25 had speech issues outside of just the diagnosis of autism, but just parents coming in with speech. On a monthly basis, we will see parents coming in with kids with speech delay. And sometimes it might not necessarily be a speech delay, but they might be worried that the kid has some tongue tie, which they want you to check up, and concerned that may lead to a speech delay. So it's things like that kind of give us the impression that it is a big problem, but not compared to things like the malarias or the TBs.
Okay, great. Lorraine, when you look at this particular subject of our discussion today, when a child is born and, of course, that child is growing, obviously their expectations, every mother would expect their child later on to do that. At what specific age is a child expected to say tata, mama, and stuff?
Okay, so when those first words come out, we're usually looking at around 1 year. But there's a lot of things that we can look at before 1 year that can be indicators of if that's going to come on time. So as Dr. Marsden said, it's an issue that we're looking at when it comes to development, and we're looking at the brain, right? The brain is going to send a message to potentially either our hands to be talking with our gestures, facial expression potentially, or speech. So before 1 year, we're expecting kids to be interacting through using their face, crying, using gestures, things like that. So we're looking at a lot more before 1 year than just those sounds. And if all of those things are happening, then at 1 year, we're hoping for that word. And then at 2 years, we're hoping for them to put 2 words together. In 3 years, so on and so forth. And so when it comes to just the single words, which is often what parents are looking for, is just that word, right? Hearing mama sounds so good. But there's these other things that we can look at to see if there's indicators that there might be a developmental delay when it comes to language. If they're not understanding no, or if they're not understanding their name and turning to hear their name, things like that are other things that we can take into consideration even before 1 year old when we want to hear the word.
Okay.
And I think that's very important, because people tend to think that speech is the be-all and end-all. But as you said, you can have gestures. So that's why there's like the speech component and the language component. Because the speech component means like how do you it's expressing language, but it's expressing language with sounds and words. Whereas when we're talking about language, it's being understood and actually you understanding. And it doesn't mean that it has to be expressed verbally. So you can express it either verbally or in non-verbal. So if I do this, like if I'm smiling, kids will understand that, oh, that person is happy. So I'm expressing language without actually having to talk. And you can do it also in written. So those two components are all part of speech and language. But in a layman term, when you say speech, they always just think of verbal talking.
Yeah, and if I can add on, children are communicating messages to parents well before they're talking. So many children, when they want to be picked up, they raise their hands, right? And so that's communicating a very clear message to their parents. And that's, like she said, that's a gesture that's used very early on to communicate. So when we're talking about the brain development when it comes to language, we're talking about much more than just the speech that comes out. The brain is sending messages to our whole body to be able to communicate properly.
Okay. All right, so ladies and gentlemen, well, that's exactly what we're looking at today. And of course, scrolling on your screens, those are that's our text line. In case you've got a question, you can actually forward it through our inbox, and of course, I should be able to get it to our experts in the studio today, so that they can be able just to help you. Okay, in case you have any experience, you have got something that you'd love to find out in relation to what we are discussing, that is speech development and language, you can actually send us that particular text or question on that particular number on our screen as well. Now, Dr. Marsden, just out of the blues, is this, is speech language and speech development and language, does it have anything to do with, the genetics or something? There's, here in Africa, Africa is rich with its own beliefs, really, and we appreciate that. So you'd find that sometimes, when a child delays in that particular communication, that would easily relate it to, okay, your aunt has got such, so I think it runs in the blood. Does that really make any sense?
In terms of, is there a genetic component? I would say that I think there might be a very small genetic component where, like, it may run in some families where they say the dad was a late talker. But in terms of evidentiary to say that, yes, there's this gene that is attached to delayed speech, then the answer would be no. So you'd find that I think sometimes some parents kind of delay in taking their kids to be seen by a healthcare professional, because they're saying, even your dad was a late talker, or even your auntie was a late talker. But what we do know is that, there are certain conditions, like I said, things like autism, and sometimes some neurological conditions that affect damage to the brain, that can cause speech delay. So you'll find that if you have kids with, like, cerebral palsy, they might have delayed speech. If you have kids who have like a traumatic brain injury, so for example, if a kid who has sickle cell had a stroke, you can find that it can affect their speech. So that's the kind of like the link.
0955 5016, 0955 5016. That's the number, so you can forward your text messages to that number, and of course we should be able to get to them, and of course be able to obviously get expert help in that particular field. When should a parent get concerned?
So we talked about how there's different developmental milestones that we're hoping to see. Before 1 year, we want to look for that interaction. Kids should be wanting to communicate with you. If you have a child that before 1 year wants to keep to themselves, they're not really making any eye contact with you, they don't want to show you the toys that they have in their hand, that should be a concern. If at 1 year you're not seeing any sounds or anything close to a word, they're not trying to communicate a message to you through gestures, you should be concerned. If at 2 years you're still not really seeing them put words together, at 2 years they should be able to say, "Mommy, drink," or things like that, where it's 2 words together, then you should start to be concerned. So it's just, as they get older, they should continue to make progress. And if you see that there's stops in progress, or it's not the way that typical development would be, that would be when you would start to be concerned.
Okay. And I think also, like, when parents feel that my 3-year-old is more difficult to understand than maybe the other 3-year-olds that are around them, because usually, for example, a 3-year, you should be able to understand, and not just the family members, by the way, because sometimes family members get used to, like, the gibberish that the child is saying, because they will know that, that whatever that child said, I understand it. But do the other people around them who are not familiar with what the child is trying to say are saying in terms of understanding what they're saying? So around 3, other people should also be understanding half of the things that this 3-year-old is saying. Around 4, everybody should be able to understand what this child is saying, and not just you, the parent, or you, the uncle. Because if you take your child, and you go and visit an auntie who is not familiar with what this child is saying, they should be able to understand almost everything your 4-year-old is understanding. So other than what Lauren said in terms of what is the when to be concerned at different stages, also is what is that child saying, and is it being understood by the people around them other than us as family members?
And often our children are going to give us these indicators, right? Kids expect to be understood, and when they're communicating a message, if they're not being understood, they're going to get frustrated because they're not getting what their message communicated. If they want to say, "Mommy, drink," but it's coming out completely different and no one's understanding it, they're going to be frustrated that they're not getting a drink, right? So we might see more behaviors from kids who are having trouble communicating because they're frustrated. So it might be more tantrums. They might fall on the floor or hit or these kinds of things because they're frustrated.
Okay, interesting. Well, this is getting quite interesting here. Now, does a home environment have any impact on the possibility of a child to communicate effectively and early with the parent is concerned?
I think the home environment, in terms of if you're not going to talk to your child, or if you're not going to show your child gestures, or you're not going to play with the child, unfortunately, one of the cultural things that we have in Zambia is that we like to papa the baby, put the baby on the back. The mom, they're busy, right? Parents are busy at the market, selling their wares, and the baby's on the back. It's convenient. But then how much interaction are you actually doing with that child? Because the child will learn language and will learn to communicate by you communicating with them, by you, singing songs with them, by you, taking little picture books, or by you playing games with them, whether it's like, those games where you're interacting and they can see your gestures. That's how, in the home environment, a child will learn to talk. But if you're like talking to a 2-year-old in a babyish way, then how do you expect that child to not learn the babyish way of talking? So the home environment is important in terms of interaction and exchanging of language, so that the child can actually learn to communicate.
How should parents, I almost said mothers.
We'll urge you not to.
What should be the parents' reaction when they realize that, all these, talking points that you've highlighted, they rarely see, that, activity in their child? What should be their reaction?
So if they have these concerns, then the next step would be to take the child to a healthcare professional and express the concerns. And depending on where that might be, they might need a referral to if they're going to go to a local clinic, they might need a referral to a bigger hospital where the doctors are maybe more experienced with seeing kids that have delays in speech, and then can refer them to the right places. Dr. Marsden might have some better suggestions than that. But
yeah, so echoing what Lauren has said, if you take a parent to your primary care provider, and you as a parent are not kind of satisfied with what has happened, you need to refer to a higher level. And at that higher level, you're going to have a contact with whether it's a general doctor, whether it's a pediatrician, which is kind of like the people that you'll be interacting with, who probably have enough specialization or knowledge to be able to say whether this child has a speech and language delay or not. And in terms of us as pediatricians, what are we exactly going to be looking for when we're talking to these parents? So we want to know, is this just a speech delay only, okay? Or do we feel that there's something else going on? Are there some behaviors that this child has that are telling us that this is part of a bigger diagnosis other than just the speech? So, and that all stems from looking at, is it just speech and language that's been affected, or are there other components of this child's development affected? What's happening with this child's, what we call the gross motor skills, the skills that children have in terms of standing, sitting, crawling, are those also affected? What's happening with this child's fine motor skills? The use of the fingers. Is this child able to pick something very tiny at 9 months of age, which they should be able to do? So we're going to be looking at other components of this child's development to help us say, is this child just speech, or is this child a broader picture of something that we should be looking more into? Because there are other diagnoses, as I said, that speech is just a component of the delay. Yeah, so once we have figured that out, regardless, it's important that when you're thinking about therapy, that you start therapy early, because that has better outcomes than if you start therapy late.
0955 5016, 0955 5016. That's the number that you're communicating to us. We're discussing speech delay and language. We've spent about 20 minutes looking at speech delay, and I'm sure that Lorraine and, of course, Emilia have highlighted what speech delay is all about. Now, let's get to the other component here, the language issue now. Obviously, later on, the child will be expected to talk, right? Exactly. In fact, I think in Zambia, that's the greatest concern that a mother would have.
Yeah.
Right.
Exactly.
Has to talk.
I think even if a child is not making those gestures, they'll just say, it's normal.
Uh-huh.
But when a child is not talking,
That's when
it
they notice.
now becomes a concern.
Yes.
Exactly, it becomes a concern.
Yeah.
So what might we consider as delayed language in a child?
So it's the same what Lauren already expressed, because remember, language, we said it's understanding and being understood.
Exactly.
Okay, so when we're talking about is this child understanding what I'm saying? When I'm talking to this child, does this child understand that the gestures that I'm doing? Is this child able to understand that I'm angry right now, or if I say do this, does this child understand that I mean, I want to pick you up? When I do this, does this child understand that this means bye-bye? When I say this, does this child understand that it means come? So when she outlined the processes of what we expect at 2, 3, and 4, it's the same processes other than just the verbal communication, what you're talking. It's the same processes with regards to what we should expect at age, as she outlined earlier.
When you come to African tradition, you're going to find that in Africa, there is this common activity that is usually performed on a child. Exactly. That has to do with the tongue and stuff, commonly called cutting kalimba and stuff like that. What is that? Is that scientific, or is it just a traditional belief? It's just a myth?
So
Good.
So Lauren and I were just having this conversation about this tongue tie, because when we initially thought about discussing speech, we had said, delayed speech and tongue tie. She was like, but tongue tie is a misconception. I said, yeah, but you don't understand how big of a misconception it is in this country. Like on a weekly basis in my practice, I will see parents bring in a child specifically, and it's usually a child smaller than 3 months old. It's specifically that this child has a tongue tie, or the auntie has said that the child has a tongue tie, as you see on the screen there. This was actually a bigger child, which was quite amazing to me, because usually they'll bring like a 9-month-old or a 3-month-old, or usually infants under 1. So there's a very big misconception that tongue tie causes speech delay, and it is a very big misconception. So it doesn't cause speech delay, and you find that that little thing underneath the tongue, it's called a frenulum.
Okay.
So parents think that if we cut the frenulum, then the child will be talking typically. But the interesting thing is that I've seen lots of parents who bring their kids in after they've had the tongue, the frenulum cut, and the child's still not talking what they expected. Then they're like, oh, okay, so we thought that if we cut this frenulum, then the child will be talking, but it's a total misconception.
Yeah, if I can add on to that, we've talked a lot about how the brain really controls our language and our speech. So the brain is going to send the message to our throat to start talking, and then all that the tongue really does is it makes the sounds come out properly so that people can understand you. Yeah. So The message comes from the brain. So if a child is not making any sounds at all, I'm not concerned about their mouth, right? I'm concerned about their brain, okay? Just this one language part, but that's what I'm more worried about, okay? And if they are making sounds, but they're not coming out quite right, then we can take a look at the mouth and see what's going on. But tongue tie is so rare, and more often than not, you can understand a child. They just need to move their tongue around a little bit differently. Your tongue has a very small role in how you actually talk. If you actually touch while we're talking right now, if I touch my throat, feel it vibrating.
Yeah.
So the next time you talk, if you feel it vibrating, that's because all of my voice is coming from my throat. So the tongue plays a very small role in speech. So if there is no sounds coming out, no words coming out, the tongue is not what I'm concerned about.
So you find that in clarity.
How we studied how from the ancient days, how we studied how we're supposed to understand us. How we studied how our mothers and our fathers could understand that. Because in most cases, when you are talking about a child talking, they always refer to the role that the tongue plays.
Yeah.
Exactly. So obviously, as we get back from the break, one thing that I want to hear from you two is how dangerous is it to cut that thing? Which is just, is it okay? Is it safe to cut it? Because I think in most cases when a child is in between that period that Dr. Marsden actually pointed out, 3 months, 9 months and stuff, and they always go to their grandmothers, just to go and get that thing cut. In a bit to make sure that a child speaks faster. They believe that if it is cut, the child will definitely talk very fast. Exactly. But how safe is it and all that? I think that is the point that I would love to get from the two of you.
So just to echo what she said, it's extremely rare. Like I've been a doctor for donkey years, so for 21 years, right? And in that space of time, I've only seen 2. Right? 2 real tongue ties. 2 real tongue ties. I mean, I get a lot of parents bringing in their babies or their children worried about a tongue tie, but it's extremely rare. And we're talking a career span of, I've seen thousands of kids, right? I had a professor who had been a doctor for maybe even 60 years, and he told me he had only seen 1. So it's very rare, right? But you can imagine that you've got a little membrane underneath your tongue that's got little blood vessels, right? There's blood vessels coasting around that little thing underneath your tongue. And people are so brave, right? I'm not a surgeon. So if the 2 cases that I saw, who's a qualified doctor, was like, I need to send you to a surgeon because I don't have the experience in terms of, cutting your frenulum. So it's a little membrane that's quite vascular, lots of blood vessels. So if you cut it the wrong way, you're going to get a lot of bleeding, a lot of blood loss, and potentially it can cause serious complications.
And even if you have a qualified person doing it, anytime you cut anything, it takes time to heal. So if your child's at prime time to start making sounds, prime time, 6 months, 9 months, they should start babbling, start making these kinds of sounds with their mouth and their throat, right? If you cut part of that and they need this time to heal, you're taking away an opportunity from them to actually maybe start making the sounds on time that they could have, because now they're in a healing process. So I think it's very damaging when it comes to making that choice for a child at such a young age and doing it, qualified or not qualified. Like we said, it's so rare. I've never seen a tongue tie. In all the kids that I've worked with, it hasn't been quite as long, but it's been in multiple countries, and so I just think people need to be quite cautious with that.
And I think people just need to understand that it's not going to cause a speech delay, because that's the thing that they're worried about. So if they're worried, first go to a healthcare provider to confirm that it's there, and actually, because it tells us of a bigger picture. The bigger picture is that the parents are actually worried about speech. Yeah, and that's what we should focus on. We need to focus on the reason why these parents think that the tongue tie is causing a delayed speech, because it's not the tongue tie that's the problem. They're thinking this kid has delayed speech. So let's focus on the speech delay and see whether is it really a speech delay, or are you worried about something that doesn't need to be worried about, and there's enough time for us to say, look, this child that you're worried about, or actually is there other things other than just the speech that we should be concerned about when it comes to the reason you think this child has a tongue tie?
Quite a lot of direct calls are definitely flashing on my phone here. I can hardly pick any of them. But if I know a lot of people have been trying to express themselves through talking, but for now, please just send us that text message, and I'm sure that Dr. Marsden and of course Lorraine as well should be able to respond to you. So at least something that obviously has definitely caught you by surprise is the fact that the tongue tie has gotten very little or possibly nothing to do with the delayed speech of your child. Did you know about that? Well, I didn't, trust me. I didn't, and that's what we're learning today. All right, for now, we go for a break. When we come back, let us look at now when you realize that, your child has this particular problem, and of course, they have delayed in terms of, their speech and language. What are some of the things that, obviously, when you go to see healthcare providers, what are some of the things that they would definitely look at, and just how do they handle all this? I think it would definitely be of help, especially to a woman who is pregnant, to a man who is expecting to be a father very soon, or to a man who is already a father, and of course they are raising children and so on and so forth. Well, this is quite of interest to all of us. For now, we go for a break. We'll be back shortly.
Africa's favorite toilet cleaner just got bigger. Now you can get 50% more cleans with the new Harpic Active Gel 750ml bottle. Harpic, your tried and trusted specialist toilet cleaner.
Why? Why does it have to be standards?
It's the same as a guy is gonna come back to his friends. No, I slept with this guy, this girl, and that girl, and that girl, and
She's such a
gay.
Why?
No, for him,
He's not even a G, he's a stupid boy. Yes, I'm being honest.
How is he a stupid boy?
Listen, why would you brag about?
Let me tell you. Always have an excuse.
Men are usually awarded for their nonsense.
3/4.
That's
You
what
think so?
it is.
You think so?
I know so.
Okay. All the best. Now, that's it.
So I can literally get into your house and tear it down because I ran it.
Yes.
You owning it.
Girl,
Nothing.
Listen. No.
It's
I
not
think
about
no.
your house.
These
You
are
own
ills
a
we need
house,
to
I
correct.
ran it.
So what?
I
You're saying guys don't know how to cook? No.
I don't think she
Like
meant that
you're a guy out
literally.
there and you don't know how to cook. Please get my number. Guys, no.
Are you Jeremiah? Are you single?
Yes, boss. We have 3 women on the show and 2 guys, but you still know we got it. Exactly.
Kings are born and not chosen. In one kingdom, the first generation, where people are happy with a lot to celebrate about. But when the first chief in Sofwa dies, it's the playful grandchild who takes over, Chief Muzo, and the palace is turned into a common house. Chief Muzo rules.
I am the king.
There is drama.
You are going to marry these 3 women.
If he was here, I could have stabbed him to death.
We bring you the best music videos, all genres, every day 12 hours to 13:30 on your favorite channel, QTV. Ngoma. Ngoma every day 12 hours to 13:30.
We love local. All of your favorite Zambian hits. And much more. Z Rampage, Fridays 9 to 12 on QFM.
Alright, so welcome back, ladies and gentlemen. The number is on your screen, and of course, quite interesting questions coming through from, all across the country. We've got Mpika, Chipata, Copperbelt, Kitwe, and of course, Lusaka, and a whole lot more other places as well. Keep those text messages coming. Alright, so now I don't know who's gonna talk about Down syndrome here, because obviously the first question here says, can Down syndrome cause speech delay?
I think, yes, the answer is yes. Can cause speech delay, and it's all part of this whole developmental thing, right? It can cause speech delay, and sometimes you will see that they might not articulate, speak, pronounce. They might not pronounce words very well, but it can cause speech delay. In terms of what can the parent do at home, Lauren?
Yeah, so the more interaction, the best. And we haven't touched a ton on social, but that is a huge part of language. So interacting, kids with Down syndrome are very social kids. So getting face-to-face with them on their level and playing with them, talking with them. When you're bathing them, talk about this is your arm, this is your, and just really be interacting with them a lot. That's going to be the best thing to do at home for any kid that shows any speech delay. And Down syndrome falls right within that. Now, should they see a speech therapist? If they can, yes. But if they don't have access to that, depending on where they live, then doing those things at home are a great step to being able to make progress in your kids' speech development.
What I wanted to add there is, and that's why for me it was very important to have Lauren in this show, because she's a speech and language pathologist, or a speech therapist, as people commonly say. The thing is that most of the times when we are trying to evaluate speech, we refer kids to a speech therapist. Now, it's very important to understand that in this country, that's a very new profession, yeah. It's a very new profession in this country, but where she comes from is only hundreds and thousands of speech therapists. We only have, I think, 3 or 4 in this entire country, and the 3 of them are here in Lusaka. Okay, so it's quite heartwarming to hear that there's people from all over the country, and then you're thinking, oh, you're saying refer them to a speech therapist. Meanwhile, the only speech therapists are in Lusaka. So we're talking University Teaching Hospital, Children's Hospital has 1. Okay, Special Hope Network, where Lauren comes from, very luckily has 2. And there's another organization that's recently opened up. It's called Sandy's Rehab, and they have 1. So we're talking 4 in Lusaka, and as far as I'm aware, there's no speech therapist outside of Lusaka. So even like at the University Teaching Hospital, the developmental intervention clinic, you can imagine that you have one person dealing with all the kids that were coming from across the country to, referred to UTH. So I think in terms of home interventions, it's very important because, you know, if you've only got 4 people serving a population of 100,000, what you teach them to do at home is cardinal, because they will be the ones to spend more time with them. They're not going to come from Mpika for sessions 3 times a week in Lusaka, or for even once a week in Lusaka. Maybe they'll come once every 3 months. So that interaction with somebody who's specialized and qualified in dealing with kids with speech delay, they only get that one chance in 3 months. So the majority of the interventions will be done at home.
Interesting. Mr. Hope from Mpika, okay. I don't know the harness there is a male or female, but the question is, what happens if a child delays in speech and crawl?
Okay. So what I've come to learn from parents over the years is that we have these big expectations of what a child should be doing at a specific time. So people get surprised when I tell them that I don't get worried about a child not walking unless they have delayed, they haven't done it at 18 months, okay? I'm not so concerned if a child is not sitting unless they haven't sat around 9-10 months, okay? So I'm not concerned about a child standing unsupported unless they haven't done it at, let's say, 14 months. People have expectations that their child should sit at 5, okay? So it's important that parents know that the developmental windows are very big, okay? So as she said, we expect that, kids will be, babbling or saying, sometimes they'll be saying mama, 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 around up to 1, okay? If they're not saying that after that, then we start to get worried. So the windows within which is considered normal are quite wide. So obviously, if you feel that as a parent you're concerned about your child's not doing this, that, and the other at a certain age, the first thing you need to do is seek professional help. So go and see a healthcare worker, okay? And I think in my experience is that when it comes to developmental issues, certain cadres of health workers might not necessarily be very astute with what is considered typical and what is not considered typical. So if you as a parent are concerned and you've gone to see a healthcare professional and then you're not happy with maybe what the healthcare professional has said, go to the next level up. So if you've been to your local clinic and the local clinic 6 months down the line is still telling you the same thing, but you as a parent are concerned, because parental concerns are usually correct, okay? They're usually correct. So if you as a parent are feeling that these people are not taking you seriously, move from that primary healthcare center and go to the next level health center, hospital. If you're not concerned, go to UTH, you know what I mean? Because as a parent, most of the times, your concerns are usually valid.
Yeah, just to add on to that, if the developmental milestones that you are concerned about are not just within one category, it's not just the communication I'm worried about, but now I'm worried about communication and motor. So this person said talking and crawling. So that's 2 different areas that they're concerned about. So as a parent, you are generally right about your expectations. Though we do expect things a little bit early sometimes. So we have to be patient, but once we're patient, if our concerns persist, then we should be persistent too, especially if they're across 2 different areas, because then we might be concerned that it is a bigger problem than just a speech delay.
Yeah.
Okay, great. Gabriel from Chipata says, are there specific words or group of letters that give children speech problems?
I'll do that
Lorraine.
one. So yeah, there are sounds that are more difficult for children to make. There's a progression of sounds that we would expect certain sounds way earlier than we would expect other sounds. For example, B, P, M, N are sounds that we're going to expect very early on in the beginning. We're expecting ba, 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 ma, 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 those kinds of things. We never hear a kid really babbling. Their first babble is la, 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 or rah, 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 right? That doesn't happen. So it's usually the B, P, M, and N that we expect to hear in the beginning. Those are our first sounds that are easy, okay? As they get harder, then it's R, S, the sh sound, the TH sound, L's. All of those sounds are more difficult, and those can take up to 7 years old to really fully develop. So if your child's pronouncing words and they're not pronouncing things quite right, those harder letters like R, S, the sh sound, the f sound, give them some time. It takes sometimes all the way up until 7 years old to really develop those sounds properly.
Okay. Obviously, this one is going to Dr. Emilia.
Okay.
Yeah, I think so. My baby is 1 year. She's turning 1 year next month and hasn't said mama, only tata. Should I be worried?
Wow. So, only says tata.
Only says tata, not mama.
Not mama.
Should I be worried?
I mean, I wouldn't think so, because the child is saying mama, saying ta 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 ta, but not saying mama, mama, mama.
Recognition there. She
Yeah.
doesn't feel so. She doesn't feel the child recognizes mama.
Yeah.
No.
It doesn't feel good, that's for sure.
No, but the thing is that usually, and correct me if I'm wrong, Lauren, usually when kids are saying mama, 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 under 1, they don't say it in terms of meaning to say mama, ma, that you are my mom, or da, 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 you are my dad.
Okay.
But we just expect that they should be saying those words by 1.
Okay.
Yeah.
Right, yeah. So there's a difference between making some sounds that sound like a word and making some sounds that mean a word.
Yeah.
So a lot of times a child might say wa, and they mean bottle, right? And it sounds nothing like bottle. But if they're saying it every single time, sometimes parents count that as a word because they mean bottle. And then other times, like Dr. Marsden said, it might be ma, 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 and there's no real purpose to what the child is saying there. The one thing I would say is if they're saying ta, 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 what we really want from that M sound, that ma, 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 is we want their lips to be able to close. So I'm not sure the age of the child.
Turning 1 year.
Turning 1, okay. So we just want to make sure that they're able to close their lips. So if you're giving them food with a spoon, can they close their lips around it so that they can, because if they're not closing their lips, then maybe we need to talk about, there might be something going on there. But that would be my only thing to be concerned about.
Yeah, so what it means is when you say ma, you have to press your lips together.
Okay.
Yeah, so if that child is like, when she's feeding her and she's putting the spoon in the mouth and she's able to, then you wouldn't be so concerned because she's doing it.
Because her mouth is capable of making that, so then we're not worried about it.
Yeah.
Okay, great. Your namesake here. That's
Lauren.
namesake.
Okay.
Exactly. At how many months is a baby expected to start crawling?
Crawling.
Exactly.
So it's a range, okay? So some kids can start as early as 6, okay? Whereas some kids take up to 1 year, 2. So it's a very big range.
And I think when we think of crawling, we think of on our hands and knees.
Yes.
Some kids don't crawl like that. Some kids scoot across the floor on the bottom. Yeah, some kids, they do all different kinds of things. So what we're really more looking at with that developmental piece is, are they able, if they want to be here and they're here, can they get themselves there? So, but that crawling piece, there are some kids that don't crawl.
Yeah.
They skip it.
Yeah. So they like, especially when they are bum shufflers, they're not going to do the hands and knee crawling.
Okay. Miss C from Tindere, she says, afternoon, my son is 3 years and 7 months, but has a problem with speech. I can't hear what he says.
Meaning she can't understand what he says, or she can't, or he's talking very softly. I'm not sure.
It could be that maybe what the child is saying, she cannot pick sense out of it.
Right.
Exactly.
So it's either is he speaking in a low tone, like if I'm talking to you like this, Nelson, as opposed to talking to you like this, or is it that he's saying words that she can't understand?
Exactly.
Yeah. So I think it would boil down to seeking an assessment, okay, with a healthcare professional to be able to understand exactly what is going on there. Is it just the speech and language that's affected, or is it other components, as we said earlier, that are affected? So I would advise, especially because he's nearly turning 4, okay? So remember that we said that any kid who's 3 years old, 2/3 of what that kid is saying should be understood. And by the time you get to 4, majority of what you're saying should be understood. So it's probably that I'm not sure whether I'm thinking that he's not it's not that he's speaking in a low voice, but he's actually she can't understand what he's saying. And there's actually one thing that's very, very important whenever kids come to see us with speech and language delay that I need to say that's important. Kids can only learn to talk if they can hear what is being said to them. So it's very important that we make sure that the child's hearing is not affected. Okay, so whenever we're doing our assessments, the first thing we always say is that can the child actually hear you? And which means that we need to get the child's hearing tested. So just like there's a paucity of speech and language pathologists, there's also a paucity of where you can get your hearing checked properly. Okay, so there's the Baycure Hospital, and then there's the UTH Children's Hospital, and also at Pendleton Clinic we do hearing tests. So you need to actually check and see if this child is actually hearing her properly first, before you start thinking about what else.
Okay. Well, time is never always our best ally, but let me pick up this one. I think this one is quite important. Exactly. I think I forgot to raise this issue during the first 20 minutes that we had this discussed. This one is coming through from somebody in Dola, and they ask, how can you know that this child is deaf or it's just a delay?
Yeah, so I think it boils down to what I just said earlier. Can the child hear? Okay, is the child able to hear you? Because if the child can't hear you, then they equally can't vocalize. They won't be able to say things because they're learning from what you are saying. So if is a child deaf or hard at hearing, we can say in simple terms, like when we're checking children for well baby checks, we want to know does this child startle to noise? Okay, so the simple things that parents can do at home other than going to have the child's hearing tested. Does a little baby startle to noise? When you bang the door, does the child startle? So things like that can help you to determine whether this child can hear or not. But sometimes hearing is not just about big, loud sounds. Sometimes it's also like the small sounds that a child can hear. Or is a child able to hear, but maybe might not necessarily process the information properly in the child's hearing apparatus to be able to vocalize something properly. So that would be what I would say, that look at the simple things first. Is a child startling? Does a child get when you bang a door? Does he get scared? Those are the simple things. But in terms of when you come to a healthcare professional, you would obviously examine, look inside the ear, because sometimes kids have repeated ear infections that may affect the middle ear. There might be fluid in the middle of the ear, but if a child has one ear that's working properly, it should not affect the way they speak.
Okay. Well, you guys, thank you so much. I know we've left a lot of the credits with text messages. Exactly, there are quite a lot. Others are even asking, does a child, when a child is born, does the child know that this is my mother and this is my father? all that. So
Yeah.
obviously, in our subsequent episodes, I think those are some of the issues that I would love to have this team back and, of course, highlight on a number of those things. I think we have... from just the text messages that are coming in, we can make an assessment. I think this is a problem in most Zambian communities. Exactly.
Yeah.
Most parents believe that, by 5 months, possibly a child should be able to start communicating effectively with the parents. And now, have you seen the number of concerns that are coming up? So obviously, very soon, I think I should be back to call on Dr. Marsden and, of course, you, Lorraine, as well, just to come and clarify on a number of things. Otherwise, thank you so much for clarifying on the tongue what?
Tongue
tie.
The tongue tie.
Yeah. Tongue tie,
tongue
otherwise
tie.
called a frenulum.
Oh, okay.
The frenulum is short.
Okay,
yeah.
great. Okay, great. So you've raised a lot of question marks now on most of traditional parents now. In case I have my child, should I take my child to go and have the tongue tie cut?
No,
definitely not.
Otherwise, Dr. Marsden, thank you so much for coming through on this episode today, and of course, Lorraine as well. Good to have you. Thank you so much.
Thank you so much.
Thank you.
All right, so ladies and gentlemen, that does it for today. I think time has not really been on our side today. I think quite a lot of messages really came through. Thank you so much for participation. Hopefully that most of your questions got answered as, my two experts were trying to explain a few things as other questions were coming through. For example, I think they have answered the question pertaining at what particular age should a child be able to say mama, tata. I think, they have repeatedly talked about age and, of course, that period. They have repeatedly as well talked about, when you're talking about delayed speech and language, we are not just talking about verbal, but we're also talking about other signals that a child gives that enables you to know that your child is actually communicating to you. And of course, I think Dr. Marsden has also touched on the point of how can you tell whether a child is deaf or a child is just having a speech delay. Other questions, obviously, in the subsequent episode that we're going to have in future, we should be able to tackle on that. Remember, this program is specifically here to discuss the relationship between the mother and, of course, children as well. And, of course, they're promoting the health of a child. And, of course, when we're talking about a child, we are not only talking about babies, but we are talking about children up to how they are defined, even up to somewhere 16, 17. We are looking at the health of this particular age group. So every Sunday is between 13 and 14. Make sure that you make a date with us. I've been your host, Nelson Zula. Until next time, it's bye-bye.